Did you know that 15% of the United States population suffers from irritable bowel syndrome? And even worse, 20% of that same population suffers from acid reflux. Yeah, I can feel those statistics in my gut. What's up, veterans? VA Disability Guy here, and I'm back again with a video that you don't want to miss because today we're going to be talking about irritable bowel syndrome and GERD because, as I told you, statistics are really high for those. Or, kind of high for those? Well, let's see. If the US population has 332 million people and 20% of those suffer from GERD or acid reflux, that's about what, 66 million people? And if 50%, what, 15% of those suffer from IBS, that's about 50 or so million people. That's a lot of people walking around with pain in their stomachs and vomit just sitting in this area. And it's very uncomfortable. I know because I suffer from it. That's what we're going to talk about today. Today I'm going to talk about IBS and GERD, how they're related, what the symptoms are, what they are, and as usual, I'm going to talk about the VA disability rating. So definitely some good information. But if you're new to the channel, go ahead and subscribe. I drop videos like this at least once a week. And if you find value in them, hit the notification bell. That way, every time I upload a video, you'll be notified. And if you all do like the content, leave a thumbs up, like the video. That lets YouTube know that this information is important and they'll push my videos to other veterans like yourself. So without further ado, let's go ahead and get straight into today's content. All right, so what exactly is irritable bowel syndrome, which is also called IBS? All right, guys, so irritable bowel syndrome is a group of symptoms that affect your digestive system. It's a common but uncomfortable gastrointestinal disease or condition that affects your intestines. People with IBS experience symptoms that include abdominal pain and cramps. With IBS, you may also have frequent diarrhea, constipation, or both. IBS doesn't cause tissue damage in the GI or your gastrointestinal tract, or increase your risk of more serious conditions like colon cancer. Instead, it's a chronic, long-term condition that most people can manage by changing their routines and what they eat, taking medications, and receiving behavioral therapy. There are also different types of IBS. So you have IBS with constipation, meaning most of your poop is hard or lumpy. You also have IBS with diarrhea, where most of your poop is loose and watery. And you also have mixed IBS, where basically you have both constipation and diarrhea. And as I said before, it's very common, and experts estimate that about 10 to 15% of adults in the US have IBS, and only 5 to 7% see an actual provider for the diagnosis. Now, when it comes to signs and symptoms of IBS, they include abdominal pain or cramps, usually related to the urge to poop, excess gas and bloating, diarrhea, constipation, or alternating between the two, mucus in your stools, and it may look whitish. Also, feeling like you're unable to empty your bowels after pooping. IBS also has certain triggers for those that suffer from it. If you are female, your periods could make your symptoms worse during your menstrual. Certain foods may trigger it, and that usually varies from person to person. Some people, it may be dairy that causes it, gluten, wheat, different things. Some people say that greasy foods tend to activate theirs. It just depends on the person. Now, this is a big one right here, stress. Some researchers suggest that IBS is your gut's response to stress. Related, this is why IBS is sometimes called nervous stomach or anxious stomach. In my own opinion, I think stress is a really big contributor with IBS, especially for those of us that are in the military or served in the military. But that's just my opinion. Now, what you're all really here for: how and why the VA rates IBS. All right, so you can get either a 0%, 10%, or 30% rating for IBS, and it's dependent on the severity of your condition. All right, so 0% is going to be considered mild. You may experience abdominal discomfort or disturbances in bowel function. 10% is considered moderate. IBS with more frequent bowel disturbances and abdominal distress. That's the cramps and the pain. Or 30%, meaning you have severe IBS. And that's when you have diarrhea or alternating diarrhea and constipation with more or less constant abdominal distress. With the 0%, your IBS is considered mild with disturbances of bowel function with occasional episodes of abdominal distress. So you may rarely get cramps and pain. For the 10%, you're having frequent episodes of bowel disturbances with abdominal distress. And for the 30%, severe diarrhea or alternating diarrhea and constipation with more or less constant abdominal distress, meaning it just does not stop when you're having a flare up. All right, now this also can be considered a secondary condition to IBS, and that is GERD, Gastroesophageal Reflux Disease. And it's the occurrence of stomach acid flowing back up the esophagus from the stomach. So a lot of people just call it acid reflux. Some of the symptoms of GERD are nausea, vomiting, heartburn, difficulty breathing, coughing, painful swallowing, chest pain, stomach aches, or other abdominal pain. Now, as far as the connection between IBS and GERD, both IBS and GERD are common conditions that affect the gastrointestinal tract. There was a study that found that nearly 64% of patients in the study who were diagnosed with IBS were also diagnosed with GERD. 34% of patients with GERD also had IBS. And in 2020 annual benefits report released by VA, IBS was the third most common digestive order among all service-connected veterans who received VA disability. Okay, so once again, IBS is the third most common, and GERD can be linked to IBS. Okay, and when it comes to the VA rating for GERD, I'm going to start at 30%. All right, so you have to have recurrent gastric distress, which is pain in your abdomen. And you also have to have dysphagia, which is trouble swallowing, and pyrosis, which is heartburn, and regurgitation accompanied by substernal or arm and shoulder pain, productive of considerable impairment of health for 30%. For 10%, you have to have basically two or more of the same symptoms that you saw down here, just with less severity. Now, for 60%, which is quite rare for GERD by itself, but you have to have symptoms of pain, vomiting, material weight loss, and hematosis, or melena with moderate anemia, or other symptoms, combinations productive of severe impairment of health. And hematosis basically means you're vomiting blood, and melena means you have very dark stools because blood is more than likely in your stools. All right, ladies and gentlemen, if you found this content valuable, leave a like on the video. That way YouTube can push it to other veterans like yourself. And if you're new, go ahead, subscribe to the channel, hit the notification bell. That way, whenever I upload a video, you'll get notified. And though this video was about IBS and GERD specifically, I do have other videos on the channel that you might want to check out, like these two above. So, until next time, take care of yourself, take care of those around you, and I'll catch you later. Peace.